Good day everyone, Happy New Year 2025. We are from Group 14 Ruminant Medicine. Today, we will present about bovine lymphosarcoma. I am Di Heng, then here is my group mate Niti and Afif. In today's presentations, we will give a short briefing regarding two types of lymphosarcoma and present two case reports regarding lymphosarcoma to enhance the audience understandings. We will start with the introduction of enzootic bovine leukosis, which is caused by a retrovirus named bovine leukemia virus. It is an enveloped RNA virus. Bovine leukemia virus can be present in many countries, and most commonly in North America. Transmissions of bovine leukemia virus occurs through transfers of infected B cells from one animal to another animal. The mechanical vector can be a biting fly or other biting insects. The virus can also be transmitted by contaminated instruments such as needles, dehorner, or castration instrument. Inside a naive host, the infected B cells will pass the pro-viral particles to the naive B cells. Now, naive B cell will become infected. The infected B lymphocyte will mutate, and it will replicate faster than normal, causing lymphocytosis. The abnormal B lymphocyte will continue to replicate. At certain points where B lymphocyte replicate too fast, they will become malignant. The malignant B lymphocytes will spread very fast inside the lymphatic system. Eventually, they may invade all the lymph nodes in the cattle, causing lymphosarcoma in the lymph nodes. The malignant B lymphocytes will also invade the blood vessel. Eventually, they will spread to other visceral organs and vertebrae as well, causing lymphosarcoma in the visceral organs and also vertebrae. The affected cattle will become emaciated. When the tumor is at vertebra, the cattle will show arching back. When the tumor affected eyeball, the cattle will show exophthalmos. The other common affected sites by lymphosarcoma include uterus, aneurysm, and liver. In severe case, the heart will be affected also, and animal will die.
Another type of bovine lymphosarcoma is sporadic bovine leukosis, and it is less common compared to enzootic bovine leukosis. Sporadic bovine leukosis commonly affect younger cattle and divide into juvenile form, tiny form, and skin form depending on age and tumor developing site. Cause of sporadic bovine leukosis is unknown, but there is abnormal proliferation of T and B lymphocyte become malignant, which spread throughout the body via blood vessel and lymphatic vessel. Thymic form of sporadic bovine leukosis cause progressive visceral and submandibular edema in cattle. Juvenile form of sporadic bovine leukosis cause enlarged parotid and submandibular lymph node. Skin form cause necrotic lesion in skin, tumoral masses at prescapular area, proliferative lesion in gingiva, and necrotic lesion in udder.
Next, we will present two case studies regarding bovine lymphosarcoma. The first case is a typical sporadic lymphosarcoma in a 3-year-old Swiss Benville cow. The patient is 3 by 3 years old Swiss Benville cow with 3 months of pregnancy. Because of poor appetite and vomiting after eating, the cow was referred to a university clinic in Switzerland. She saw no response to treatment with a Ruminant, an NSAID drug, neostigmine, and vitamin B. Ruminant was used to treat any traumatic reticular peritonitis, while the neostigmine is used to improve the rumen and reticular motility. During physical examination, the heart rate was low normal. The skin turgor reduced with male sunken eyes indicate dehydration. Steroid injection was also observed. For alimentary system, the cow showed hypersalivation. Transrectal exam revealed distended rumen. Feces had a porridge-like consistency and dark olive in color. And after 15 minutes after eating, the cow vomited liquid and foul-smelling ruminant contents. So, based on the primary clinical sign, which was vomiting, the problem was more to upper GI tract. Thus, the DDS include traumatic reticular peritonitis, indigestion, lactic acidosis, abomasum depressment, and bovine lymphosarcoma, which is caused by bovine leukemia virus. CBC revealed leukocytosis, which indicate active inflammations, mild exothymia and hyperphosphatemia, which may indicate dehydration, increased liver enzyme, which may indicate liver injury. Hypokalemia indicates hypokalemic compensated alkalosis, while the hypochloremia may be secondary to abomasum reflex syndrome. Analysis of ruminant fluid revealed marked increased chloride concentration of ruminant fluid. This indicated an abomasum or proximal small intestinal obstructions, which will cause reflux of hydrochloric acid from the abomasum into the reticular rumen. While the blood gas analysis revealed metabolic alkalosis with best access. ELISA for bovine leukemia virus was negative, and there was no abnormal finding for reticulum radiograph. The left ultrasound image shows two enlarged hypoechoic lymph nodes corner to the reticulum, while the right ultrasound image shows spirals of abomasums extended to the cranial flank region at the level of costochondral junctions. The abomasum ingesta can be seen, and the wall of abomasums was thicker than normal. Based on the ultrasound findings, which were enlarged lymph nodes and thickened abomasum wall, a tentative diagnosis of bovine abomasum lymphosarcoma can be made. The cow was euthanized due to graft prognosis. For the postmortem finding, the left image shows severely thickened ulcerated, slightly reddening abomasum folds, while the right image shows severely thickened and firm mucous membrane of abomasum pylorus. Here, the blue arrow shows two severely enlarged lymph nodes, which were located corner to the reticulum. For histopathology, there was infiltrations of all layers of the abomasum wall, the serosa of the abomasum, and the enlarged lymph nodes with the homogeneous population of round lymphoblasts with little cytoplasm and a round to oval nucleus. Immunohistochemistry showed that the lymphoblasts were CD3 positive and CD79A negative, and thus they were T lymphocytes. So based on the postmortem histopathology and immunohistochemistry, our definitive diagnosis was sporadic lymphosarcoma. We exclude out the bovine leukemia virus, exotic lymphosarcoma, which usually causes B-cell lymphoma.
Hello everyone, I'm Nityanathan Jaikandan. I will be continuing with our second case report, which is exotic bone leukosis in 4 years old Holstein Friesian lactating cow. Exotic bone leukosis is an infectious disease of cattle caused by bovine leukemia virus that result in lymphoma within target tissue. For patient signalment, the patient is a 4 years old female Holstein Friesian cow. For the history part, on September 2005, farmer noticed ocular dysfunction on right eye of the cow. The cow was presented to veterinary hospital Facultad Integrado Combe Mora of Puerto Rico. During physical examination, the cow's rectal temperature was 39 degrees Celsius, which is indicating pyrexia. There was presence of mass in exophthalmia of left eyes. The submandibular, prescapular, and iliac lymph nodes were swollen. For diagnostic workup part, agar gel immunodiffusion and histopathological evaluation were done. Agar gel immunodiffusion helps to detect presence of antibodies that produce against bovine leukemia virus. Histopathological evaluation is necessary to identify malignancy of the tumor. The cow was euthanized and proceeded with necropsy. From the gross lesion, we can see that submandibular, prescapular, iliac, pulmonary, hepatic, splenic, inguinal, mesenteric, and mediastinal lymph nodes were severely enlarged. Section surface of most lymph nodes reveal that severe proliferation of a whitish cream soft that replaced part of normal architecture of the organs. In these gross lesions, same masses were observed in vaginal and uterine walls, and also added to the large uterine ligament. Several similar masses were seen added to the thoracic vertebrae. Hepatic and splenic involvement resulted in severe hepatomegaly and splenomegaly. Multifocal whitish area were observed within cardiac muscles. The histopathological findings revealed that lymphoma characterized by diffuse proliferation of neoplastic lymphocytes. which distributed in an extensive solid pattern. In some area, the neoplastic cells are separated by strand of connective tissue. The neoplastic lymphocytes appear with rounded nucleus, carned cytoplasm, and granular chromatin. Based on the agar-gel immunodiffusion and histopathological evaluation, the tentative diagnosis for this case is bovine lymphoma. The prognosis is poor since bovine lymphoma is not curable.
There is no vaccine for bovine leukemia virus. Thus, control measures are very important in order to protect the herd. Firstly, use cautery or other brothers methods of dehorning. Secondly, clean and disinfect all equipment between animals for procedures such as castrations, tattooing, and ear tagging. Thirdly, never reuse needles between animals for blood collection or injections. Fourthly, keep handling facility clean. Next, control biting flies in order to lower the animal's risk of exposure. Last, test animals regularly for the virus to detect early infections and eliminate them from the herd. Here is our resources. That's all for our presentation. Thank you for listening.